I want to go through post-op instructions, what to expect. These are for after the procedure. It's very normal to see small amounts of drainage on your dressings, some blood, some just extraneous material, pain, tenderness, swelling, bruising. All that's normal for the first 2 weeks of surgery. That should steadily improve after the first few days where it peaks. It should peak the first few days and then drop off and improve. Nausea may be experienced the day after your surgery for the first 24, 36 hours, and that's related to the anesthesia. I typically give most of my patients the prescriptions for pain medication and antibiotics when I see you in the office. That goes straight to your pharmacy. So you should already have that. If not, please let us know. And then we should have you back for a post-op appointment at about 2 weeks to see how you're doing. The 6th week is typically a training visit. As soon as I see you inflate and deflate the device, you're good to go. You can use it that evening. But 2 weeks is a quick visit. I just want to make sure you're on the right track. Instructions for right after the surgery. The mummy wrap dressing can come off 2 days after the surgery. It's a wrap dressing, long gauze, and that's there to maintain compression so that there's not significant amounts of swelling or blood accumulation within the area we worked. So 2 days, that comes off. We leave the tip exposed so that you can urinate, but everything else should be contained within the mummy wrap. There's extra gauze that we put on outside of that, just loose within the jock strap. That stays on for an additional 2 days. That's there for added compression, okay? We're really trying to minimize how much the swelling is able to happen. You're going to continue the jock strap for the full first week after surgery. After that, you want to get some kind of compression shorts, tight underwear, something that's going to provide support so that after surgery the penis stays upwards and the testicles, the scrotum supported so that there's not significant amounts of swelling and uncomfortableness. Position your penis upwards so the head is towards your abdomen as much as possible. We don't want that to get stuck in a position where the penis is bent and then you have to overcome it to get it straight. You want it to start out straight and be that way, okay? Keep it up towards the abdomen. You can place an ice pack inside the scrotal support, but not directly on the skin. A lot of people, that works best for the first 2 to 3 days after surgery, okay? Make sure you drink plenty of fluids. Make sure you stay well hydrated. Make sure you're walking around the house. Raise your legs when you're sitting down. Do not drive yourself the first week after surgery. Do not lift any heavy object greater than 10 pounds for at least 2 weeks, 2 to 3 weeks after surgery, okay? Make sure your bowels are moving normally, you know? If you have constipation, I recommend using a stool softener like Dulcolax or another stool softener called Miralax. 3 capfuls 3 times a day after the surgery will help you get going, okay? You need to poop. If you don't poop, it's gonna hurt, it's gonna be uncomfortable. You need to poop. Eat lightly the day after surgery because it's gonna take a while for the bowels to get going again. So eat lightly, don't eat a ton of food, and then return to your normal diet as you tolerate it. Make sure you finish your antibiotics completely, even though you're feeling better. You can take a shower 4 days after the surgery. 4 days. That's the same day that you can stop using the extra dressing, the extra gauze. And avoid tub baths for 1 full week after surgery. I need things to heal up and close, so 1 full week, avoid the tub. After surgery, you can walk around the house, you can move. I don't want you to get a blood clot, so you're at risk for a blood clot because you have a surgery, and if you're sedentary afterwards, you know, you're not moving, you're not pumping the blood through, you're at risk for a clot. So you still gotta move around, you gotta go up, go use the bathroom, go to the kitchen, get something to eat, you gotta move around, okay? Gradually, you're gonna increase more and more as you get more comfortable. The reasons to call, Call if you have a fever over 101.5. Got to let us know. If there's excessive drainage from your wound, especially blood or pus, call, let us know. If there's pain or scrotal swelling that's not improving after the first week of surgery, let me know. If there's significant redness around the incision, around the scrotum penis area, this isn't bruising, this is redness. If it's inflamed and red and it's not improving, you got to let me know. And then going forward after the surgery, if you have some type of like dental cleaning, you should take some antibiotics just as a preventative thing. Just call my office, we'll send it to your pharmacy, or we can kind of give you a stock ahead of time. You just take it the day before, the day of, and the day after, just 3 doses. It's just preventative to help prevent infections in the future. So remember, our office hours are 9 a.m. to 4 p.m. The phone number is 614-293-8155. For emergency questions, issues, anything emergency, that's weekends or outside of office hours, you need to call the main hospital line at 614-293-8000 and ask to speak to the urology resident or on call. All right?